our next awardee, Professor Kevin Fenton CBE. Give him a big hand, please. Yes. The Windrush Nation Awards recognizes Professor Kevin Fenton CBE for his work as a public health and infectious disease epidemiologist. He has worked successfully in health prevention and health improvement for more than 3 decades in Jamaica, the United States, and the UK, and is currently the Regional Director of Public Health England and the Regional Director of Public Health for NHS London. As President of the Faculty of Public Health, he is leading the charge in setting the standards for public health specialists in the UK. We salute him for his drive for improving health and tackling inequalities globally. Well, I'm delighted now to be joined by another of tonight's Windrush Nation Awards recipient, Professor Kevin Fenton CBE. Professor, thanks for joining us here on Live Radio UK. Just get your reaction, first of all, to the award and to the old Windrush Nation Thanksgiving gathering tonight.
Well, it's so wonderful to be here tonight and this evening on Windrush Day. It's a special day when we're both reflecting on and thinking about the legacy and the contributions of that original generation to this country, but also to celebrate and reflect on the progress that we've made.
Yes.
And tonight meeting so many wonderful colleagues, people from our community, and listening to the pride and the joy and the communion that we had has just been special.
Yes. And overall, when you think of the Windrush Nation and what has happened since '48, how do you think we've done over that time?
So, in the work that I do as a public health specialist, I'm always looking at global migration, how people move and how health, well-being changes as a result of that migration and movement. And I think the story of the Windrush generation is an interesting one because we had a particular cohort of people from the Caribbean who traveled over, who had very challenging experiences in those early years. And we see the legacy of some of those challenges living on in generations today, both positively and negatively. So I think for the generation that came and that had such a fundamental role in building our society, I think we've done so much and accomplished so much. And the challenge is, how do we continue to pass on that legacy, a positive one, to our children and our grandchildren?
Absolutely, thank you. And you were born in Glasgow.
I was.
But you were brought up in Jamaica. How was that transition for you from Glasgow to Jamaica?
They say when you move once in your life, once you've done a big move, all subsequent moves are a lot easier. I left Glasgow when I was about 2 years old. My parents went back to the Caribbean, and then I came back after medical school. So I've had the privilege of moving back and forth across the Atlantic. And I tell you one thing, the concept of home truly is where the heart is. And I can arrive in London and I can be here in the UK and feel at home. But I'm so privileged to be able to travel back to the Caribbean and feel equally at home on the streets of Kingston, on the beaches of Montego Bay.
Yes.
I can call that home as well. And that gives both a sense of pride, but also a sense of grounding as well.
Yes, and you went to university, started there in the University of West Indies.
That's right.
But you changed discipline.
Yes.
What prompted you to make that switch?
Well, in those days, you could get into medical school directly from high school. And I was accepted for medical school, but had a year off to do natural sciences. So I started off doing computer science. And perhaps had I known how big it would have been, I probably would have stayed in computer sciences. Although having said that, I did medicine, and my medical specialty brings my mathematical and love of data and analysis that I had as a computer scientist into medicine as an epidemiologist. Yes. So now I study infections, I study diseases, I track them, I know how to control them.
Right, okay.
So I haven't lost it all.
Okay, good. And so now, You did some work at the hospital there in Lucy.
I did.
In Hanover. And so whenever I go there to see my father, I would look at the hospital again and said, oh yes, this is the place. And so you did a lot of work in public health there as well. So public health, what was happening in the health service, if there was such a thing, in Jamaica?
Yeah.
That was prompting you, you know what, I need to be over there. I need to be in that part of the field, looking at public health.
Well, it's such a really interesting story because in the first week in medical school, in all medical colleges, one of the things that the medical schools do is that they introduce you as a new student to professors and lecturers, people who are in different medical specialties. And in my first week at UWI, University of the West Indies, we met people who were working in public health. And they told us the story of how, as a physician, you could not only treat one person at a time, but you can improve the health of millions at a time, of societies, of communities.
Yes.
And how you do that, not by giving them medicine, but by changing policies, by changing the environment, by investing in education or good quality jobs. And I'll never forget that first week in medical school, how that changed my perception of what medicine is and how I could practice.
Yes.
Now I have another good story, which is the Lucy story.
Yes.
Which is after medical school, I had a chance to be the medical officer of health in Hanover. And Lucy was about a 20-minute drive from my grandmother's house, which is in Kendal, Cessnock area up in the hills of Hanover. So I still have to this day memories of doing my 9 to 5 at Lucy Hospital, driving up to have dinner with my grandparents. Some of the most special memories of my time in Jamaica before coming here.
You did some work at the CDC. Share a little bit of your insight into that assignment.
From Lucy, I came to the UK and I spent 10 years here to my postgraduate training, became a consultant, and I had been appointed the head of HIV and sexually transmitted infections for the UK here. And then I was recruited to work for the Centers for Disease Control in Atlanta in the US government. And I was, at the time, the most senior non-US citizen working in the US government. And I had the privilege of working for the last 4 years of President Bush and the first 4 years of President Obama. And really overseeing the domestic and global program for HIV for the United States. So it was an amazing nearly 10 years in the US. And I think what it showed me was, number one, a different system and how they manage the challenge of infectious diseases. Two, CDC is a powerhouse of science. And so for me to be able to do good research, good science, and to make a difference. And three, working in the US means that you have to work with communities and you have to understand inequalities, community mobilization. And because of my experience in the US, it really did a lot to prepare me for my work in the UK and, of course, the COVID response.
Of course. And have you found over those three continents any commonalities in terms of public health or failings and so on?
Great question. In all countries, we tend to think that what drives health is the hospital. And the focus that we often have is on hospital treatment and care, rather than understanding that actually health is generated in homes, within family units, within communities, by having a home, a healthy home, having a family that support and love you, having neighbors who you can trust. And as we heard even tonight in Windrush, a community that supports you along your journey. So most systems, whether in the Caribbean, in the US, or here in the UK, we focus on the NHS, but we don't focus on how do we prevent people from getting unwell, and how do we help people when they are unwell to manage themselves to get better. And we need to do more of that for systems to be sustainable, right? We're seeing the pressures now on the NHS. They're having the same pressures in the US as well. So more and more, especially after their experience in COVID, we now understand the importance of prevention, early intervention, community support, community engagement as a key part of what we need to do.
And during COVID, did you find that your message was received, because the black community suffered, disproportionately? Did you find that your message was received better by them because it's coming from someone of their own? I don't know, that's anecdotal, but you know.
I think so. In fact, I know that. You know, the amount of people, even this evening, you know, in the event, who said, listen, every time you were on the radio, we listened to what you had to say. Not only because you were speaking as a senior scientist, but because we knew that you were speaking as one of us.
Right.
And also your values, your tone, the way you spoke really resonated with us. So there's something about our lived experiences as people of color that allows us to perhaps have more empathy.
Yes.
To understand the real world lives that people are living and the challenges that they have. And to be able to speak to some of those as well.
Okay. Well, Professor, thank you very much indeed. Professor Kevin Fenton, a recipient of the Windrush Nation Award. Thank you very much indeed, sir.
Thank you so much.
Thank you. All right. Take care.